Hello and welcome to today's exciting medical quiz session. I'm Dr. RMD, the main host for this session, and I'm thrilled to test your clinical knowledge. Joining me today are our two amazing co-hosts, Dr. Rupal and Dr. Manoj. Welcome to the show.
Thanks, Dr. RMD. I am excited to put these medical minds to the test. Let's see who's ready to ease these challenging cases.
Absolutely, Dr. Rupal. We have got some tricky questions today. So get your thing. Let's get started.
Okay, so let's move on. Let's kick the questions. So here comes your first questions, guys. Here is the first question. Prolonged use of which drug can lead to vitamin B6 deficiency? The clue is patient has peripheral neuropathy. So your time starts now. This is a very common clinical scenario where you come across this question.
I think it's very crucial to, supplement vitamin B6 when treating patients with very good isoniazide to avoid peripheral neuropathy.
Yeah, so this is a common clinical case scenario which comes across in day-to-day basis because we start anti-tubercular treatment for many people, and then they come up with this peripheral neuropathy. I myself have seen 3-4 cases of this coming to our OPD. Let's see the leaderboard. So Tanya is leading right now with 89 points, followed by Sriraj and then Shanmuga Priya. Let's move on to the next question.
Yeah, here a 45-year-old female with celiac disease develops keratomalacia involving less than 1/3 of her cornea. So according to the WHO grading, what is the staging? Or what is the grading here?
This WHO grading is very important for NEET-PG point of view. Yeah, so 8 of them have answered it correctly. That is X3A staging. Two important points to be remembered here. One is the grading of vitamin A deficiency, which is under biochemistry and ophthalmology as well. Second is, whenever you come across any child or any adult who has keratomalacia, which is very rare nowadays, but since vitamin deficiency is suspected, always rule out malabsorption. Okay, because in an adult like 45-year-old female, we are not expecting the patient to have a diet lower in vitamin A, and vitamin A is a fat stored vitamin. So that's why there is the deficiency is very less. Okay, but if it is occurring, then always suspect malabsorption.
That's quite intriguing knowledge that Dr. RMD has discussed with us. Please keep in mind, these are the very important questions that will help you to go through your NEET-PG exams.
According to leaderboard, now Malar is leading. I think Malar is a new contestant. I haven't seen Malar in the last quizzes. Tanya and Shanmuga Priya are following at second and third places. Let's move on to the next question, right, team?
Yes, sir. Good.
Next up, this is a clinical scenario. A 10-year-old boy presents with delayed wound healing, alopecia, dermatitis, and recurrent infections. What mineral deficiency is most likely seen here?
I think the correct answer is zinc. Maybe zinc is the essential for proper immune function and skin integrity. Maybe.
You're just telling them the answers, Dr. Manoj. That's not fair.
Okay, so Malar is leading again with the longest streak, followed by Tanya and Shanmuga Priya.
Wow, good going.
Let's move on to the next question. I think biochemistry is closely related to pediatrics, so I can relate so many things, especially this question. A 12-year-old boy comes with hepatosplenomegaly with neurological symptoms. Which protein is responsible for the transport is defective in this case? a very cleverly framed question, and this type of the questions, these are the type of questions which are to be expected in a in an entrance exam, and also these cases come in day-to-day basis also.
And the right answer is ceruloplasmin. This is a hallmark finding in Wilson's disease.
So Wilson's disease is not as uncommon. Any child who is between 5 to 15 years presents with mainly first is hepatitis. Okay, waxing waning type of hepatitis or acute on chronic type of hepatitis. Along with above findings and the low ceruloplasmin, always think of Wilson's. We always in our setup here in PJM or RN hospital, any hepatitis, we always work up for Wilson's to rule out Wilson, because you never know if there is an underlying Wilson's on a setting of acute hepatitis. Okay, so always keep this point in mind, and this image is also very classical, always asked in entrance exam. So ceruloplasmin levels are decreased in Wilson's disease.
And I think 3 of them has marked it copper also, sir. I think they have not read the
Copper,
question completely.
yeah. The copper is not the protein. Ceruloplasmin is the protein that transports copper.
Hmm.
These are the fine details which students miss. Right now we have Tanya leading, and followed by Shanmuga, Priyan, and Grishma. Good going, guys. Let's move on to the next question.
Okay, which vitamin acts as a cofactor for the gamma carboxylation of glutamate residues in clotting factors? I think this question has been asked many times.
Clotting factors is a common question for both pathology and biochemistry, and especially regarding gamma carboxylation, it's examiner's favorite, and everyone has answered it. So I don't think there should be any confusion also, because only vitamin K is related to clotting factors. So there shouldn't be any doubt, except for vitamin C, where bleeding is seen, but that is because of defective protein synthesis and not as per related to clotting factors. So most of them have answered it right, and Tanya is leading again with the longest streak, followed by Shanmuga Priyan, Grishma at third place, Malar at fourth place, Soumya, Jasmine, Sari, Deep, Sriraj, and Karthik. So many more questions to go, guys. So be on track. Let's move on to the next question.
This is a clinical vignette. A 40-year-old farmer presents with diarrhea, irritability, hyperpigmented, scaly rashes on sun-exposed areas, especially around the neck. What is the most likely diagnosis? This is like the question that has to be embedded in your mind.
Yeah, I think many of them got it right by seeing the 4Ds.
Wonderful.
Okay. So Tanya is leading, followed by Shanmuga Priyan and Grishma. Is next question a surprise? Okay. So match the following.
Yeah, match the following.
This is the surprise that we have kept for everyone. Let's see.
Okay, so the question says, which is the most common acute porphyria?
Yes.
Okay, and the most common porphyria overall. Okay. Even though we study so much about porphyria, in my last 2 years of pediatric residency, I haven't come across any cases of porphyria so far.
Let's see.
9 of them have answered it correctly. Most common is acute intermittent porphyria, and most common porphyria all over is porphyria cutaneous tarda.
That is
Though we
correct.
had some suspected cases of acute intermittent porphyria, but still they didn't turn out to be porphyria. Okay. Right now we have Tanya, who is leading at 618 points, followed by Grishma and then Soumya.
Oh, nice. Tanya is maintaining her streak.
Exactly. Yeah.
I think if you have just read the previous question, this would get a little more easier to answer.
So today's topic was vitamins and minerals, and we have included porphyria because many questions are asked, and this is a confusing topic. Unless you study porphyrias, you are not going to crack these questions. Only two of them have answered it right because this is always a confusing topic. So the answer is ADP defect, that is aminolevulinic acid dehydratase deficiency porphyria.
That's correct. The fact is, these porphyrias questions, they end up being those questions, which make the little difference of thing known
Exactly.
as
Yeah.
marks.
The ones who have studied only can answer this. You can't guess these questions.
That is right. Okay, moving on. Erythrocyte transketolase test is the most widely used method for the functional assessment of which deficiency? Sometimes we think that we have read a topic, so, and we have like read it in depth, but now and then there are like some tiny, tiny things that just, miss out. So these are the tiny things that gives us the extra edge.
Yeah, I think this question was asked in 22 or 23 NEET-PG, I guess. Similar question.
Yes, that's correct.
Right now we have Tanya again and Grishma, followed by Grishma, Shanmuga Priyan, Soumya, Mala. Prague is at 9th place, but Prague has the longest streak.
And Tanya is still leading the leaderboards quietly, silently, and came prepared.
Yeah.
50-year-old male comes with tachycardia, pedal edema, irritability, loss of GTRs. These signs and symptoms point to which type of thiamine deficiency. If this question was asked to any resident or maybe any clinician without the mention of thiamine deficiency, they would have completely gone off track because the symptoms show raised heart rate, pedal edema, irritability, which are symptoms of heart failure. And on the other hand, there are neurological symptoms also. But mainly raised heart rate, pedal edema, irritability, all these point towards wet beriberi.
Right. And the neurological symptoms belongs to the dry beriberi.
We have Tanya at 793 points, followed by Grishma and then Shanmuga Priyan. Malar is at 4th place.
All right, guys, the last question, your make and break.
A young child presents with a periorificial erosions, enteropathy, and stomatitis. So this is suggestive of.
I think this has to be the easiest question because the answer itself is in the question.
Yes, yes, sir.
So this is the part where I wanted to imply to everyone that you don't have to overthink the question. Sometimes it's just like this, and no one did. Perfect.
Yes, so it is zinc deficiency. So this type of children present with diarrhea and with perianal rash, some skin lesions. They'll have oral lesions also. So they usually include, but nowadays we are seeing less cases of this because for every diarrhea, zinc is being supplemented. So frank zinc deficiency is very rare nowadays. Let's see the final leaderboard. Okay, so we have winner that is Tanya at 884 points. Congrats, Tanya.
Congratulations.
Congrats, Tanya.
It's great to see you on the top of the leaderboard.
Tanya was second and third winner in many previous sessions, but I think this is the first time she is the winner, right?
Yes,
Yeah,
that's
yes, sir.
Uh, so consistency matters a lot.
and she's
Right.
holding the longest streak as well. I think she has this longest streak since like past 2, 3 quizzes as well. That's quite commendable.
At second place, we have Grishma. Third place, Shanmuga Priyan. Congrats, Grishma and Shanmuga Priyan. At fourth place, we have Malar. Malar, many more quizzes to go. Keep following and keep attempting these quizzes. Fifth place, we have Deep, Soumya, Sari, Jasmine, Prag, and Biko. So congratulations, guys. So now we'll be the winners will be getting a certificate, and the first winner, that is Tanya, will be getting Amazon coupon voucher. So we'll be providing it and intimidating the details to you in the further sessions. Now we move on to the explanation part. I guess it's visible now.
Yes.
So in the previous quiz, that is quiz Optal quiz part 2, conducted on December 14th, winner is Dr. Ashish. Congratulations, Ashish. He was also the winner for the previous quiz also. So he will be receiving Amazon coupon voucher also, and he'll be receiving a participation winner certificate. Congratulations, Ashish.
Congratulations, Dr. Ashish.
In the last quiz, we had Hemant at second place and Sriraj at third place. Both these are consistent contestants at JuxtaMed quiz. Congrats, Hemant and Sriraj. You will be receiving participant certificate via email.
Okay, guys, coming to a recap of the questions here. So this slide will give you a quick overview of vitamin K, which is also known as anti-hemorrhagic factor. So the main sources are green leafy vegetables, cabbage, spinach, and one endogenous source is intestinal bacteria. So the recommended daily allowance for vitamin K is 50 to 100 micrograms per day if the intestinal bacterial synthesis is normal, or if it is present, or else it is 1 to 2 mg per day if intestinal bacteria is not synthesizing. And the main functions of vitamin K is the activation of clotting factor 2, 7, 9, 10 by gamma carboxylation. And other functions are to increase bone calcification and to maintain the vessel condition. If the if this vitamin is deficient, then the clinical features are hemorrhage and decrease in bone calcification and delay in bleeding time and clotting time. And one more question we had was on Wilson's disease. So this is a autosomal recessive disease, which is nothing but an inborn error of copper metabolism. Uh, so the main defect here is the deficiency of ceruloplasmin or decreased level of ceruloplasmin, which is a transporter of the copper. And also there is one more factor leading to Wilson disease is decreased biliary excretion of copper. The main clinical features here are if the organs involved mainly are liver, basal ganglia, cornea, and kidney. If the liver is involved, we'll have clinical features like acute hepatitis leading to hepatic failure. And if basal ganglia is involved, patient will complain of we can see ataxia and tremors. And in cornea, we can see the KF ring, which is classical for Wilson's disease. And also, some patients may go to sunflower cataract. And in kidney, we can see renal tubule damage. So the investigation done here will be seen as decreased serum copper, decreased serum ceruloplasmin, and urinary copper is increased here. So the gold standard investigation here is liver biopsy. And one of the main treatment is by using the chelating agent, which is penicillamine with pyridoxine. Or we can go with liver transplant also in severe cases. And this is a very important table. I think this will go into your 20th notebook. Every time we'll have a one question directly or indirectly asked on vitamin A and its grading. So one important point to remember is Bitot spots, which is X1b. And basically, to remember it as easy, only X1 and X3 has part A and part B. All others are direct. Like XN is night blindness, and one has two, A and B, which is nothing but conjunctival xerosis, and B is Bitot spots. X2 is nothing but corneal xerosis, whereas X3, we have X3A, X3B, which is nothing but less than one third, more than one third keratomalacia. And at last, we have XS and XF, which is scar and xerophthalmic fundi. I think this will complete the quick recap of the topic.
Everyone, please note we have following links for JuxtaMed. The first is a YouTube page, YouTube channel by the name of JuxtaMed Quiz. The second is Instagram channel by the same name. We have a JuxtaMed Quiz Telegram group. We have WhatsApp channel. We are on Twitter, that is X, and we are on Threads. So for all updates regarding the quiz and also regarding timing of the quiz, the topics, you can follow us on all these socials. So always stay updated and don't forget to subscribe, especially on YouTube channel.